President, as the ranking Democrat on the Senate Finance Committee, I can tell the Senate here this morning that there is no higher priority for Senate Finance Democrats than the well-being of healthcare patients in this country, and how strongly we feel about their having a right to good quality, affordable health care coverage. And right now, too many of those folks are getting ripped off by an insurance lobbyist dream, taxpayer-funded junk insurance, or by big pharma that is always looking to engage in price gouging for one reason: they can get away with it. Take insulin. Insulin prices are up 13-fold in recent years. Drug's not 13 times better. It's the same insulin we've had around for decades. But the reason the pharmaceutical companies do it is because they can get away with it. And now, this morning, I'm going to take a few minutes and talk about what this really means for patients. Because I can tell you this fall, there are a lot of families across this country who would rather be prepping for holidays than worrying about their health care. Unfortunately, the Trump administration is refusing to provide that kind of security for our patients. Let me tell you about a youngster in Oregon named Jasper to begin. Jasper is 3, full of energy and love, and a big fan of playtime with cars and trucks and trains. He was born, however, with huge medical challenges: cystic fibrosis, cardiac and pancreatic problems, hearing loss. He needs a variety of treatments multiple times a day. It's so hard on Jasper's family. It's so hard on Jasper. And of course, the costs of Jasper's care are in the stratosphere. The family is fortunate to have health insurance through a parent's employer. They know how absolutely vital it is to have what they consider to be a lifeline: the protection of the Affordable Care Act. At the heart of the Affordable Care Act are bedrock, ironclad protections for people like them. No discrimination by insurance companies against pre-existing conditions. That was something where we used to have some support from the other side of the aisle. I know about that because I wrote a bipartisan bill that had airtight, loophole-free protection against what essentially was discrimination against those with pre-existing conditions, and we got it into the Affordable Care Act. Yet now we see the other side of the aisle, they're trying to unravel those protections. They're trying to unravel the protection that we would see for patients with respect to big expenses, because our approach had no annual or lifetime limits on coverage, no coverage denials that drag people into bureaucratic nightmares, young people covered on their parents' plan until age 26, and lots more. Those protections save people's lives and make health care affordable for millions of Americans. Unfortunately, with the support of my colleagues here on the other side in the Senate, the Trump administration wants to eliminate those protections so important to Jasper and families like his. My colleagues on the other side are standing by and just basically doing nothing while the administration and Republican-led states are out there maneuvering in the courts to get the entire Affordable Care Act wiped out. It's the so-called Texas case. an absurd lawsuit based on an absurd argument, an argument that wouldn't pass the smell test in a middle-class school mock trial. Somehow right-wing ideological judges have kept it alive. Because this lawsuit keeps hanging around, tens of millions of Americans might lose their health care with hardly any warning and no fallback options to protect them. Now, Republicans have claimed they have fix-it bills that they could pass in the event that their allies took down the Affordable Care Act. They do read like they were written by the lawyers and the lobbyists on the payroll of the big insurance companies. If insurance companies can hike up the cost of treating a pre-existing condition so high that it becomes unaffordable, it's no different than being denied coverage at the outset. And while the Texas case moves forward, the Trump administration is continuing to allow junk insurance scam artists to defraud Americans into buying worthless plans that aren't worth really the paper they're written on and certainly don't cover the health care that Americans need. This is, and I want to be very specific about it, Mr. President, this is an insurance lobbyist dream. You've got tax breaks for junk insurance. That's on every insurance lobbyist wish list for the holidays. I think it's federally funded fraud, plain and simple, but unfortunately it's got the support of a lot of Republicans here in the Congress. Now, it's now the middle of the open enrollment period for health insurance on healthcare.gov. The Trump administration's support for junk plans has created a whole new burden for families across the country who are shopping for insurance. And I'm particularly troubled by this, Mr. President, because I remember what junk insurance used to be like. I was director of the senior citizens at home for almost 7 years before I was elected to the Congress. And those were the days when you could go around the country, whether it was Montana or Oregon or anywhere else, and fast-talking salesmen would sell 10, 15, sometimes 20 policies to supplement a senior's Medicare. They were called Medigap policies. And they were useless. Seniors should have saved that money to pay the rent and maybe make sure that they had heat in their house. And finally, we got rid of those Medigap ripoff policies. When I came to the Congress, it was my top priority. We got it passed. It was a bipartisan proposal. But now junk plans are back. They're different than those Medigap ripoffs, but much like what I battled when I was the head of the senior citizens in Oregon, they're still built around the same proposition. They're essentially worthless. They are an insurance lobbyist dream. And in the case of what we're dealing with, the administration's gutting the Affordable Care Act, I think it's essentially tax breaks, federal tax breaks for junk insurance. And that's why I think it's tantamount to federally funded fraud. The Trump administration's support for junk plans has created a whole new burden for families across the country who are trying to shop for insurance that gives them real value. Those shoppers used to be able to trust that junk plans had actually been banned from the marketplace. Now those shoppers have got to wade through Byzantine and manipulative marketing scams and incomprehensible insurance lingo to try to figure out if they're getting coverage that actually helps them or is, as I've described too often, just worthless junk. What's worse, the Trump administration actually redirects people looking for coverage from the healthcare.gov website to third-party brokers who can sell unsuspecting customers junk plans. It is, I think, astounding that the Trump administration has seen fit to heap another burden on vulnerable people, and after we have called this administration out on it, they're not willing to do anything to correct it. Unfortunately, since the beginning of the Trump administration, with the help of too many allies in the Congress, it's been one attempt after another to take health care away from vulnerable Americans, millions of vulnerable Americans. Those like the 3-year-old little Jasper and his family that I started talking about at home in Oregon. On the fundamental level, Mr. President, this is a debate about whether this country is going to go back to the days when health care was for the healthy and wealthy. And that was the way it worked if the insurance companies could clobber somebody with a pre-existing condition. If you were healthy, didn't matter, didn't have to worry. If you were wealthy, you just sat down and wrote out a check. That's the way it worked. But when I came to the Senate, we put together a bipartisan bill, airtight, loophole-free protection for those with pre-existing conditions. There are colleagues on the other side of the aisle, Mr. President, who co-sponsored my bill. And by the way, the President of the Senate knows who was the leader of that effort. One of his predecessors in the Utah delegation, the late Senator Bennett. So this idea that we're just going to sit around and go back to the days when health care was for the healthy and wealthy, that is not acceptable to finance Democrats that I have the honor of working with. It's not acceptable to any of us on this side, and it shouldn't be acceptable to my colleagues in the Congress. That's where Donald Trump wants to return to, the days when health care was for the healthy and wealthy. They've made it clear by working to eliminate pre-existing condition protections in the Congress and the courts, by giving insurance lobbyists federal tax breaks for junk insurance plans, and by seeking to slash programs, health programs for the vulnerable. I just want to make it clear, Mr. President, that on this side of the aisle, we're about patience. We're about protecting patients. We're about the proposition that in a country as strong and good and rich as ours, where we're going to spend $3.5 trillion this year on health care. If you divide the number of Americans, it's like maybe 325 million and 3.5 trillion. You could send every family of 4 in America a check for $40,000. We're spending enough to take care of patients. We ought to be doing more to protect them rather than turning back the clock on young people like Jasper and his family. And I just wanted to make it clear, we'll be on the floor talking about more patience in the days ahead and on the fight, a fight we are going to prosecute relentlessly to protect those patients under the Affordable Care Act. With that, Mr. President, I yield the floor.